We have received reports of racketeering in some designated vaccination centers. This is not necessary, as vaccination has been scheduled in phases, such that frontline health workers and those at the higher risk of the infection are vaccinated first after registration at the portal. Everyone will be vaccinated, and the vaccination is free. There is no need to pay for any vaccine. The outcome of the meeting was a reassurance of the safety and efficacy of their vaccine against COVID-19. We have not yet recorded unusual side effects among those who have received the vaccine so far, which includes both the Honorable Minister, the two ministers, and even my humble self. NAFDAC is monitoring the process as part of a global tracking of adverse effects of the vaccine. Anyone who has received the vaccine and is experiencing any adverse reaction should please report to NAFDAC using their app called Med Safety App. It's available both on Android and on iOS. Or you can also reach out to the center where you receive the vaccination. In the last week, we have recorded a total of 1,080 cases. This is less than what was recorded daily during the second wave, even with the sustained testing. While this is good on its own, we should not account of this or rest on our hours, for it is still too early to do so. We shall continue to sustain our testing rate to ensure that we identify, isolate, and treat positive cases in our dear country. This is necessary to avoid a third wave, which some countries are presently experiencing. In addition to this, we are sustaining distribution of the available commodities, that is the PPEs, consumables, to ensure availability at all times for end users at the treatment centers. Evidence has shown improvement in management of cases, as many gaps identified during the supervisory visits have been addressed. Some centers are operating in new and purpose-built isolation wards, while there is an ongoing remodeling of some of these centers. The centers have improved workflow, better infection prevention and control, availability of better equipment, such as the oxygen concentrators and ventilators, etc.